to introduce themselves. I'm Catherine Hansen. I'm the Chief Operating Officer with UCR Health. So let's go through. I'm going to ask Paul.
Hi, I'm Paul Hackman. I am the Compliance Privacy Officer for School of Medicine.
Jason.
Hi, good afternoon. I'm Jason Espinoza, Interim Director for Office of Emergency Management.
Thank you. Denise.
Hi, good afternoon, everyone. Denise Woods, Assistant Vice Chancellor for Student Affairs, overseeing health counseling and wellness.
Mary.
Hello, everyone. I'm Mary White. I'm from Human Resources. I'm the Policy and Communications Analyst for the department.
Thank you. Paul.
Oh,
did you already go,
yes,
Paul?
I did, but I can do it again if you want. I'm Paul Hackman, Compliance and Privacy Officer for School of Medicine.
Sorry, I'm going down the list, so
That's
you shifted to the bottom. Sheila.
Hi, good afternoon. I'm Sheila Hediati, the Executive Director of Environmental Health and Safety.
Thank you. And then Victor.
Hello, I'm Victor Ortiz, Senior Counsel for UCR with a focus on health and research.
Great. And I'm going to ask actually Linda to introduce herself because she'll be helping answering questions.
Yeah, so my name is Linda Roney. I am a project manager with the Clinical Affairs Department.
Thank you. All right, so we're going to go ahead and get started with the session. Just a bit of a disclaimer, this information is intended to provide guidance and expectation to supervisors, managers, and employees regarding roles and responsibilities, symptom monitoring, case investigation, maintaining confidentiality, potential exposure, and contacts. So let's go ahead and move forwards. So I want to talk a little bit about the daily COVID wellness survey. And again, as we move along, please feel free to enter questions into the Q&A tool. Okay, so with the survey, so the reason for the daily wellness check-in, it's to reduce the spread of COVID in the workplace and community at large. The daily survey has questions specific to COVID exposure, symptoms, and test results. The new survey that was released a few weeks ago contains case investigation questions such as who have you come into contact with, when and how long, and were you both wearing face masks? Covered employees are considered work on campus or another UCR property and are required to complete this daily online wellness survey. So again, these are just for people that are coming onto campus or another property for that day. If you're a remote worker, you do not need to complete the survey. This survey is also being extended to students that are going to be living on campus. So covered employees include academic and staff employees, volunteer services, agency workers, contingent workers, and person of interest. Following the completion of the survey, you're going to receive a certificate of clearance, which notifies you and your department that you can come to work, or you'll be advised to stay home, depending on how you answer the questions. So where to find this wellness survey if you haven't already saved it as your favorite. The survey link is on the EHS website, and it's the pink box that says take the COVID-19 wellness check survey. So when you log on to the wellness survey, it's going to ask you to go through a single sign-on. And I think by now everyone has experienced this survey, but it will prompt you to sign on using what we call Google OAuth account, and then it prompts you to go through the UCR single sign-on. If you haven't already done this, you're going to have to create a new account or add another account using your UCR email address. So whatever your net ID is. For those individuals who are vendors or contractors and they're not an employee, we do have also a link that's going to be added to the EHS website, which will does not have single sign-on. So we have a couple questions. We'll just start. So Linda, do you want to answer the first question?
Yes, so the first question is how do visitors get permission to come to campus? For example, I have to bring some heavy items to my office and would like to bring a helper. How do we do that? You first need to make sure that you get approval from your supervisor, and then you also need to make sure that you take the daily COVID-19 wellness survey before going. Mary, any additional thoughts?
No, no additional thoughts at this time. You covered it, Linda.
The second question is, will we receive a copy of the slide decks? Yes, we're actually recording this. And Linda, if you could just respond in the chat as to how they could get this information.
Yes, I went ahead and did that, and then it appears that there's a clarification. The individual wants to bring a visitor with them to campus, and so I believe that would be a Mary, Victor, or Paul question.
Okay, so I saw that, Linda. Thank you for pointing that out. They would need to get their permission from their supervisor to have someone else come on campus. Generally, we would like to keep our employees limited to coming on campus, making for sure that they're clear to come on campus. And if we have other visitors coming on, it just exposes us a little bit more. So I would have the individual speak to their supervisor and they can have that conversation with their HRBP for the department.
So in other words, Linda, we are not requiring third parties who are not employees or students that are coming onto campus to complete the survey, correct?
That is correct, but I believe we are also limiting visitors.
Right.
Campus as well, yeah.
Okay, so thank you. I'll move on to the next slide. So now you're seeing just a little bit of information about the survey itself, and I want to go over how you're cleared to come to campus. So if you're responding, I will be on campus or another property, then there's 3 questions that are key to determining if you're clear. If you answer no to, do you live with someone provided care at the home to someone or have been around someone who has been sick or tested positive for COVID in the past 14 days, if you answer no to that question, no to the next question, which is, are you currently feeling sick not due to another ongoing medical condition? So an ongoing medical condition would be, I have asthma, I have migraines. That's separate from what we're looking for. We're really looking for if you have a new condition that could be a new condition such as difficulty breathing or a fever over the past few days. Have you been tested for COVID in the past 14 days? And if you say no or you say yes, but your results are negative, you're going to be all cleared. So all these 3 questions, you'd have to be have a no answer to be cleared to come to work. Okay, so we'll move on to the next one and then we'll stop and answer a few questions. So advise to stay home. There are the same questions we referred to in the cleared to come to campus slide. If you say yes to any of the questions, yes, you've been exposed, yes, you're not feeling well, or yes, you've been tested positive, you will receive an automatic notification that you need to stay home. And then that will trigger a process for which you will have a 14-day, there will be a process for which you will receive emails on what to do next. You need to monitor your symptoms, your temperature, and such. And if you are advised to stay home, you do not come to campus or another property, UCR property. You have a 14-day self-quarantine period unless directed otherwise by HR representative. So we have had employees that they may have identified that, oh, I'm not feeling well, and then they realize that it's an ongoing medical condition. So maybe I have migraines, then I answered I'm not feeling well, but it's not related to COVID. So it could be that HR, after having a discussion with the employee, might change the self-quarantine period. If you have not already done so, contact your doctor for a telehealth appointment. Your supervisor or department will receive an automated email after you complete the survey. You will receive a follow-up email and may receive a call from the COVID-19 hotline if we have further contact tracing questions. If you have any further questions, you can call us at 1-844-UCR 6UCR or email us at COVID-19 at medschool.ucr.edu. So if you are showing COVID-like symptoms or tested positive, you will be required to obtain a return to work note from your doctor or medical provider before being allowed to return to campus or another UCR property. So let's stop and answer a couple questions. Let's see. So the first question is, I am a UCR employee. I am stationed at the Kearney AG Center. So this individual's already taking a UCANR survey for the past 2.5 months. Do I need to do anything else for the on-campus survey? So I'm going to see if there's anyone on the panel that can help answer this, because it looks like, oh, there's a separate survey that this person is using.
I can try to answer that, Catherine. This is Sheila. Hi, Andreas. I don't think I've spoken to you directly, but I've worked through your EH&S director, Brian Oatman, and we've had conversations about the A&R facilities. And from my understanding of what the agreement is for A&R locations is that you would continue to submit to the A&R through the A&R process. And then if there are any folks, whether they're UC Riverside, UCLA, or any other campus, then the A&R folks will reach out directly to our HR and coordinate at that point. And because you are quite a bit of a distance from us, I know the policies and procedures and the SOPs that they have in place are very specific to those locations, and we want to make sure that you get anyone in that facility gets prompt response and any necessary testing or treatment done.
Thank you so much, Sheila. I'm going to ask Linda if she could take this next question.
Yes, so the next question is, when I was completing the survey, the sign up for Qualtrics screen came on. So I signed into that. Then each time I clicked the next, the sign up for Qualtrics ads came up and I had to press the back button to get the next screen. Can you clarify if participating in the Qualtrics app is required? So yes, in order to complete the survey, you do need to participate in the Qualtrics survey. I personally have not received any of the ads, so I'm not certain if it's individuals taking it from their phones versus tablets versus desktop. When you are signing in, make sure that you're signing in again using that Google Oath process, and I believe that should resolve it. Has anyone else in the panelists, have you experienced anything? Paul's shaking his head no. So it's an anonymous attendee. Please feel free, we're gonna pop up the mailbox on here. Please feel free to include, to email us directly there, and we'll have somebody from the hotline follow up with you to help walk through and resolve the issue. All right.
Linda.
You're welcome.
More question, let's see. Okay, I think we are good. Let's move on to the next slide. So I want to talk about a little bit about retaking the survey. If you feel sick at any time during your work shift, let's say you came into work and initially you were feeling fine, but by noon you're not feeling so well, you need to immediately isolate yourself, inform your supervisor, and ensuring social distancing when you inform your supervisor, and go directly home. Please retake the daily COVID wellness survey and report your symptoms. That will help trigger an advice to stay home. So a little bit about case investigation. We have case investigators that are employees designated to help slow and prevent the spread of COVID by conducting phone interviews with employees who've tested positive. Case investigators work to determine the close contacts and anyone who has been within 6 feet of the employee for 15 minutes within a specific time frame. Case investigators then reach out to inform close contacts of possible exposures. Case investigators do not reveal the name of the person who tested positive for COVID when speaking to the close contacts. If an employee can't be reached, a voicemail is left and ask employees for a call back. If we don't hear from an employee after a few attempts, the employee's supervisor will be asked to help reach the employee. Okay. Some of the case investigation questions are related to your close contacts with others while on campus or in clinic or another UCR property over the past 14 days. So we ask that you be prepared to answer questions about where you've been on campus or another UCR property, as this information will be used to determine if an area needs to be cleaned to ensure the safety of others. So here's a few of the questions. What was the last day you worked on campus or another UCR property? Did you have close contact with any other person while on campus over the past 14 days? Please list the name of the people you met with in person while on campus or another property. If you were inside a building, what's the name of the building? What floor were you located? What room numbers were you in? What areas in the building did you spend? And were you less than 6 feet away from the other person? And how long did you spend near that person? So what counts as close contact? If you were in contact with someone who tested positive for COVID uh, below and meet any of the following conditions. So if you were within 15 feet of someone who has had COVID for a total of 15 minutes or more, you provided care at home to someone who is sick with COVID. You had direct physical contact with the person, shook hands or touched the individual. You shared eating or drinking utensils, or they sneezed, coughed, or somehow got respiratory droplets on you. So steps to take. If you've had close contact, contact the COVID wellness hotline to report the close contact at the number you see on your screen. Stay home and monitor your health for 14 days after your last contact with the person. Watch for a fever, cough, shortness of breath, or other symptoms. Stay away from others, especially people who are at high risk for getting sick. And what about COVID testing? Well, you could schedule an appointment for testing 5 to 10 days after your contact with a person who has had COVID. I want to clarify that a bit, because if I've learned today that I had close contact, if today I had close contact with somebody who tested positive for COVID, if I go get tested today or tomorrow, the test results may come back negative, right? Because I just had the contact. So it makes what we are suggesting is you wait at least 5 days to go get tested from that close contact. Even if you test negative for COVID or feel healthy, you should stay home, since the symptoms may appear 2 to 14 days after exposure. So the survey trigger. So what happens after you complete a survey? So for the employee and the supervisor, a clearance to come to work is sent out. So you receive this notice, or a notice advice to stay home. HR receives a notice, so they know to discuss the medical leave protocol and return to work protocol with the employee and supervisor. And facilities receives a notice, so they can disinfect campus areas if the result of a positive test was received within 7 days. And of course, the person was on campus. Facilities informs the building occupants of extra precautionary measures, which may include cleaning or restricting access. So if I haven't been, or an employee hasn't been on campus for a few weeks, it doesn't trigger facilities to clean that area. What we're seeing is most of the positives, employees are either remote workers or they haven't been on campus for quite a while. So we're going to go through a couple scenarios and ask you some questions. And so Linda, could you just walk through these questions? And if we could get those, the questions ready to go, the polling.
Yes. So Sarah, did you want to go ahead and send out the poll to everyone? We're going to go ahead and give you a few minutes to answer each one of these scenarios. Each one of the scenarios in the polling area. The first question is, an employee working in a research lab does not feel or look well. As their supervisor, what should you do? A, send an employee to campus leaders for guidance, or I'm sorry, send an email, excuse me, to campus leaders for guidance with details about the employee. And B is instruct the employee and other people in the lab they need to get tested for COVID-19. And or C, send the employee home immediately and instruct him to report his symptoms by completing the daily survey. The second question is, an employee reports that someone living in their household tested positive for COVID-19. As their supervisor, what should you do? This is a multiple choice question. So inform others about the employee and close the unit until it can be disinfected. Send the employee home immediately and instruct him to report his symptoms and the exposure by completing the daily survey. Well, and then the third option is send an email to covid19@medschool.ucr.edu with the employee's name and cell phone number. And then the third question is, an employee reports to their supervisor they tested COVID-19 positive 10 days ago. The supervisor should close down the department, sending all employees home, require everyone get tested for COVID-19, and have the area disinfected. So that's a true or false question. It looks like we're getting some, answers coming through. We have about 24 respondents out of the 71 on the call. So we'll go ahead and just give it another minute for people to respond.
Let's go ahead and answer the first question. So with the first question, an employee working in a research lab does not feel well. As a supervisor, what should you do? So the correct answer is send the employee home immediately and instruct him to report his symptoms by completing the daily survey. So it's great. We had 96% of the responses pick the correct answer. So we want them to go home, report his symptoms by completing the survey. HR will follow up with the employee within 1 to 2 days to discuss the appropriate leave and return to work protocol. All right. We will go to the next question. So with the next scenario, an employee reports that someone living in their household tested positive for COVID. As a supervisor, what should you do? So the correct answer is actually B and C. So send the employee home immediately and instruct him to report his symptoms and the exposure by completing the daily survey, and send an email to the covid@medschool.ucr.edu with the employee's name and cell number. And we had a mixture here. We had 12% pick the first answer, and most of the participants picked the second answer. So let's go to the last question. So an employee reports to their supervisor that they tested positive 10 days ago, the supervisor should close down the department, send all employees home, require everyone to get tested for COVID, and have the area disinfected. So it's interesting, almost a 50-50 split. 52% said true, and then 48% said false. So the answer is false. If you look at the question, they tested positive 10 days ago. So at that point, facilities, we wouldn't be disinfecting the area. The person hasn't been on site for almost 2 weeks. So the supervisor should ask the employee to retake the daily wellness survey to report his test results. A case investigator will contact the employee to ask additional clarifying questions. And then the supervisor should work with the HR representative to communicate a possible exposure if warranted. All right. And then if you have any feedback about the survey, wellness survey, we'd love to hear from you. So please feel free to email our COVID-19 email address, and we will definitely, want to improve the survey however we can. And then these are just the website that's under EHS, some additional information, procedures for employees and supervisors. So you can go to this website and get information on symptom monitoring and reporting procedures. And we want to give you a couple updates about some other things. We are actually on campus. We have started doing COVID testing in parking lot 25 over at the Student Rec Center North. And so by the end of this week, we should know what our regular hours are going to be. Last week, we had 2 days of testing on site. The testing is for employees. It's a saliva test. It's a 10-minute appointment. Typically doesn't take the full 10 minutes. You could either drive through or walk up. And there's no charge to the employee, and you'd expect a 2 to 5 day turnaround depending on the demand. And then one more thing we're offering is we have a flu shot clinic that is taking place on Monday, September 21st and Friday the 25th from 9 to 4 over in the parking in the Student Rec Center basketball courts north. You could park in parking lot 24. An email went out a few days ago with the link to sign up for an appointment. Another reminder will be going out today in the campus newsletter, so you still have time to sign up. Monday's getting pretty full. We still have a lot of availability for Friday. We have about 600 vaccine appointments available. And there's no charge to employees, and employees do not need to be a Kaiser Permanente member. You can have any insurance. Our HR policy covers hourly employees. They may take up to 2 hours of paid time to get their flu vaccine, and the employee must provide notice to their supervisor. On the screen, you'll see the appointment link to make an appointment for the flu vaccine. Okay. So I'm going to stop, and Linda, let's take some more questions if we have them.
We have a lot of questions that came in. So one of the questions is, don't they have to complete the daily survey before going on campus? And this was entered a few slides back, and the answer is yes. Any employee, student, or one of our contact vendors is required to complete the daily wellness check survey before going to campus. However, employees who may not be working on campus also need to report if they're having symptoms, if they've tested positive, or if they've been in close contact with someone known to have COVID-19. So I work remotely most of the time. If I meet one of those 3 conditions, I either need to take the survey to report that, or I need to call the hotline to let them know. So I think that might be where that confusion came in. So you still need to report even if you're not going on campus.
And Linda, can I add something?
Absolutely.
So if someone has already taken the test and they're at work, like right now, I happen to be in the office. If I were to become ill, then I would retake the survey, correct?
Absolutely, yes, correct. So as Catherine mentioned on the previous slide, you would want to make sure that you self-isolate so that you're not potentially spreading germs to others. Let your supervisor know. You would go home, then retake the survey and also contact your healthcare provider for additional guidance. All right, and then Catherine, the next question is, are the results of the test reported to public health? And this is regarding to the COVID-19 test. And the answer to that is also yes. The lab will be reporting the results per the state laws, and I know Paul can expand on that if needed, but both the CDPH and the Riverside Department of Public Health will be notified of test results, both positive and negative.
Right, positive and negative. We are required to report it.
All right. And then Catherine, do we have to pay for parking in lot 24 if we're going for the flu shot? Does anyone on the call know the answer to this question? I honestly do not.
This is Mary. No, you don't need to pay for parking. You'll be able to park in the North SR basketball courts, parking lot 24, and there will be no cost.
Thank you, Mary. Does the test detect past COVID infection or only current infection? So the answer to that is we're not doing antibody testing. We are doing the saliva collection, and so it'll only detect the current infection. And then since the campus has required the flu shot, how is this reported? So Catherine or Mary, I think you guys might have more information on this.
Okay, so this was the last question. Linda, you're saying?
Yes, it's since the campus has required the flu shot, how is this reported? I think what the person's looking for is how will we know if someone has had the flu shot?
Okay, so I believe right now we're working on that process. I know that we're working on that process. We have a task force that's in place, and they are looking at the survey as an option for employees to be able to indicate whether or not they had the flu vaccination, and if not, if they have a medical exemption or a religious accommodation that needs to occur. But as we get more of those details together, we will have an SOP to help direct the campus, whether you're working on campus or working off campus, to understand the process in which UCR will handle the flu vaccinations.
Yes, this is Catherine. Mary's correct. We are working on a survey. It's a very brief survey, and we hope to have the survey out by the end of this month. Because November 1st is a deadline for getting the flu vaccine. So please keep a lookout in your email box for that survey.
All right, great. And then the next question is clarifying that the COVID-19 testing is for employees only and not employees and their family members. And that is correct. At this time, the testing will be open for employees, and leadership is reviewing requests regarding family members. This has come up a few times, but currently it is only open to employees. And then Student Health Services will also be testing these students. The next question is how often should employees on site at least 3 times a week be tested? And then will testing be mandated for employees?
This is Catherine. So currently, testing is not mandatory for employees. So we don't have an answer on how often you should be tested. I think at this point, it's up to you. If you are experiencing symptoms or been in close contact with someone, you should consider being tested. But Mary, any other thoughts about it being required?
No, we don't have any information at this time on it being required. If something changes, we will communicate that to the campus community though.
Right, so the next question is, do we sign up for the COVID-19 test, or can we just drive up? You do need to go ahead and make an appointment for employee testing. There's also a walk-up option. So, you know, if you didn't want to drive in and you wanted to come up because you're on campus and walk over, either way, you would need to book an appointment for employee testing. And then the next question is there a deadline for staff, faculty to get the flu shot by? And Catherine mentioned that is November 1st. And then let's see, is it correct that that this is still only for staff who are working on campus and not working from home? If this is referring to the COVID-19 testing site, the testing site is open for employees who are working remotely and also working on site. So it is another option in addition to the other testing sites that are out there. If it's referring to the flu vaccine, I will go ahead and open that one up to Mary or Catherine to answer.
Yes, so for the flu vaccine, it's not specific to those either working on campus or working from home. It's the flu vaccine clinic is open to all employees.
Great. The daily survey link wants to use a Google account to access qualtrics.com and says my existing Google account is not the correct domain. Do we need to create a new Google account? And the answer to this question is no, you just need to sign in with your net ID. So make sure that you're using your net ID. I know for individuals with, you know, email addresses that aren't UCR. So for example, mine is a med school email address, and I know the university extension has also experienced this. Make sure that you're signing in with your net ID at ucr.edu, and it should go ahead and log in. If you're still experiencing challenges, contact Main Campus ITS, and they can assist you from there. We get a lot of questions at the hotline in you know, about the survey about why are we following this format and doing single sign-on. It has reduced a large number of the errors, reporting errors, including typos with email addresses, student, you know, or supervisors' information and things like that. So it's just been very helpful for us on our end. All right.
And Linda, I do want to mention we are working on a new version of the survey, which potentially could eliminate single sign-on and still allow us to have autofill of the employees' information by sending out unique codes to their email addresses.
Great. So the next question is, I have a couple of employees who have already informed me that they do not plan to take the flu shot, but have not disclosed whether they are allergic or a preference. Who should they reach out to check on whether they can be exempt from having to get a flu shot? So Mary, I think this falls under you.
And I also want to suggest that if you take the flu vaccine survey that we send out, it will give an option that they want to request an accommodation, and those employee requests will be routed to disability management. Mary, did I miss anything?
No, that is accurate. Thank you. So, oh, just one more thing. If they asked if they will be able to work on campus, and again, as Catherine mentioned, working with the Disability Management Office will help determine whether or not there can be accommodations for individuals, whether it would be working in an area in their department where they're not in contact with other people, or continued work remotely, and other options that may be available to them.
Great. So if a person needs a COVID test for a medical procedure to take place and it is negative, they don't need to report that, correct? My understanding, and Paul, correct me if I'm wrong, but my understanding is both positive and negative results are required to be reported to the Department of Public Health.
So the lab that's performing the test is required to report it to the Department of Health. So if it's a test that we run through our lab, we will have to do that report. But if you're going to a hospital to have a procedure done and your test comes and they run the test, they will report those results to public health as they're mandated to do. But you don't have to come back and tell us about it. So I think the answer is no.
Thank you.
Mm-hmm.
Linda, I'll take the flu shot questions so we can get through these pretty quickly. If there is an exemption approved for the flu shot for someone, will they be able to work on campus? So whoever has the exemption should complete the flu shot survey and just click the option that they have an exemption. And Someone from, and Mary, correct me if I'm wrong, someone from the disability office will reach out to them for further guidance.
Yes, it would either be the Disability Management Office or the designated medical officer for the campus.
Thank you.
Mhm.
And how do you make an appointment? If this is an appointment for the flu vaccine clinic, we provided another reminder will be going out today, so you can make an appointment for either Monday the 21st or the 25th. We also provided that link in the slide deck. I'll ask Linda to just shoot the link out to everyone. Monday's filling up very quickly. For the testing site appointments, we are waiting. We should have some new dates that we'll send out via email to campus by next week. There's a question. I received the flu shot in January 2020. Do I need to get another shot? Yes, the flu shots that were given early in the year are for the 2019-2020 flu season. We are looking for flu vaccines for the 2020-2021 season. So typically the earliest you can get that flu vaccine is August of 2020. So the flu shot is mandatory for employees, but not for family members of the employee, right? Correct. We are just looking at the employees and not their families. So I think we're going to take we're going to move on, and then we can answer questions at the end because we'd like Sheila to have enough time to present some useful information. So Sheila, I'm going to stop sharing my screen and let you take over.
Great, thank you, Catherine. Okay, I know we're giving you a lot of information. I've got a little bit more. And just give me 1 second to get to my link. There we go. Okay, so we've talked a lot about the specifics about the wellness survey and the flu shot and some specific questions about the process in which to report. What I'd like to do in the next few minutes is to go back a step and talk about who's coming onto campus. Hopefully by now you've all taken a look, let me expand this a bit. You've all taken a look at the campus coronavirus webpage, which is on the EHH's on the homepage, and you can find it under coronavirus resources and updates from the campus homepage. It'll bring you here. And I'm going to focus in on this tab right here, Return to Work Protocols. So when you click on that tab, first and foremost, it's going to remind everybody that we are still working remotely to the extent possible, and that the majority of the folks that have returned to campus are considered essential personnel. So you'll see our officers, our facility services staff, and others never quite left campus. We're here to make sure that things continue to run smoothly, like we're our own little city. And then as we see students return for the fall, more and more units may feel it appropriate to return to campus. We are still under stage 2, or the purple stage, as Governor Newsom has provided updates to our categories, which means that all returns to the workplace must be pre-approved by the supervisor. That is step number 1. So supervisors do have a responsibility to ensure that the return is justified and appropriate under our pandemic conditions. And once that approval is reviewed at the supervisor level, there may be other committees on campus that also need to review the campus return plan for that work unit. So I do want to stress that we do have a return to work guidance, which is designed to follow the California Department of Public Health Institutes of Higher Education guidelines that we are all following. There is a complete return to campus guide, which basically covers all the infection control processes and roles and responsibilities. You can download it here. But what's even more important, after reading all of that, is for each work unit, each department that's returning to campus, the supervisor is responsible for completing the worksite specific COVID prevention plan. This is a step that must be completed by all supervisors. And we've tried to make it as systematic and simple for supervisors as possible. So it's designed as a checkbox. So you need to address all the items identified on the checkbox. It does ask some specific questions about the locations of where individuals under the supervisor's purview will be returning, and risk assessments need to be completed for those spaces. So for example, if there's a meeting room that is under the purview of that supervisor, how will that work unit ensure physical distancing and other requirements? And so we've given some options here. You can, and items that need to be accomplished for that meeting room space. We talk about disinfection. Where will the disinfectants be located? This is it seems very specific, but it's necessary as part of that work unit site specific plan. And at the end, it's critical that this worksite specific plan is communicated to all employees and that it is signed by all employees in that work unit. And this needs to be kept on file. So that is step one. Can't get any further than that first step. If you are approved to return to campus, then before you enter campus, you need to take the COVID prevention training, which is found online. It's in the UC Learning Center. So you can sign in. It's already been assigned to all employees on campus, so you should see it in your learning transcript. It should point to it already. It's 12 minutes long. You review the video, you answer a couple questions, and then you can share your transcript with your supervisor. They actually have access to your transcript as well. The other thing that we've talked about is the daily wellness check, and you can find links to that here. There's also, some of you had questions about the single sign-on and the connection to Google. There are instructions here at the bottom as well. Thank you, Catherine, for helping put that up there, so we have that information for you. After the daily wellness check, the other items I just want to point out quickly is that since April, so a couple interesting facts. We were the only UC campus that was because of the county we were in, where we had a county-wide mandate to close. All other campuses did not fall under that order back in March. And so we in a way, we're a little ahead of the game because the county also came up with a face covering mandate before it was required statewide. So we were able to acquire face coverings for the entire campus back in April and start distributing to those that needed a face covering on campus. If you are now returning to campus or soon to be returning to campus and need a face covering from us, we have plenty in stock. You can come in and click on the face covering request form. And if you provide your information, you can get the different types of masks and select a date which you'd like to come pick it up. And you can come to the EH&S building and get that picked up for you. So you can get a number of face coverings. And what we're hoping to do is also provide face coverings throughout the year. So if after a few months you've exhausted your face cover, you don't want to wash it anymore, it's kind of reaching the end of its useful life, feel free to come back and request some more. We've got plenty. And it's important that you've got something on hand. Hygiene. So we do have facilities services has disinfectant kits that are free for the first one is free. And then after that, you can purchase additional ones for your department. It comes with hand sanitizer, some painter's tape, so you could put in some directional flow, paper towels, and disinfectant spray. And it's important to note that we've vetted all of this. We've looked at the safety data sheet, so we know that number one, it is effective, it's EPA approved, and it also is not caustic or harsh to the extent that it needs additional personal protective equipment. So you don't need to necessarily wear gloves or anything to wear prior to using it. So we urge you to use what's available through facilities because we can vouch for its effectiveness. Here, there's also some standard operating procedures that have been developed for how to clean office spaces, how to clean around specialty scientific equipment in laboratories. And we also have a disinfection response plan that you can view that's been developed by facilities. So, for example, if there is a case, a COVID positive case in a workspace, there have been templated plans that will be sent out to that particular work unit or department or area to inform everyone of what's happened while maintaining private health information, and then also what to expect in that area. Lastly, in this section, we've got a video on reminders of good hand washing technique, 20 seconds with soap and water. We also have the custodial cleaning schedule for the campus. And there have been questions in the past about HVAC ventilation systems. And so we have a FAQ available to everyone to answer some most common questions. And we also have an SOP for if there is a requirement and it's part of your work site specific plan that your supervisor has completed. And if you do need to share campus vehicles for any reason, there is specific guidance on how to safely and effectively, I don't know if you can see, I'm clicking over, so I hope you can see this, the COVID shared vehicle safety SOP. And that is available to you as well. And just a couple more things. We have developed signage throughout the campus. These are all free. They've been pre-printed and they should be in just about every building, on every floor, every elevator, every stairwell. But if you notice that your area might not have them or they're getting old and raggedy and you would like some more, you can also request pre-printed signs. So we have our general sign of keeping people healthy. This should be about every door. We also have state and local guidance on pool and spa use. Physical distancing, these are adhesive floor markings that are available that have been posted in multiple areas across the campus. Elevator signage, stair signage, etc. And that's all available to everyone on this call. And there was some mention about visitors, so we do have some non-UCR affiliate information. So again, this is truly meant for vendors who are coming to drop off supplies. We typically have not heard of a lot of other folks on campus other than our FedEx folks, our air gas, and some of our contractors in the construction area who are on campus, and they've all been provided this information. So that's what I've got. I think there's a couple questions out there.
Yes, so Sheila, would faculty in an academic department need to sign off on the work site specific plan?
Absolutely. This is required for every location on campus, regardless of your affiliation. This is part of a Cal OSHA requirement.
All right, so the checklist has items like used colored painter's tape to indicate where people should stand. How do we check that we have done this before we are approved to return to campus?
Okay, I'm reading it again. Let me make, okay, the checklist has items like use colored painter's tape to indicate where people should stand. How do we check that we have done this before we are approved? Well, you need to be, okay, I'm not quite sure how to answer that, but so you need to demonstrate that this is your plan to put into place before you have your staff return. Does that make sense? That you've considered all these items and this is part of your return to work plan. I hope I answered that clearly.
Okay. So face coverings are required on at all times, inside or outside. Is that correct?
Correct. Now, and again, this is coming directly from CDPH, and however, I will say that there are instances, especially, for example, our facility services staff who are with our landscaping crew. And so we have, in the SOPs, have identified that for when you are outside and there's no one around, you must have your face covering available, but you don't have to wear it if you're working alone outside.
Okay. Is there an estimated campus reopening date?
No. There was a notice that went out from the chancellor's office saying that we are expected to continue working from home to at least the end of the year. So from my understanding is that we're not giving any definite campus return. It all has to be cleared by the state.
And then what about if we want to come to campus to eat at the barn? Do we take the survey? If we bring a guest with us to the barn, what are the permissions needed? The barn has done a lot of advertising to get people in.
Yes, you should be taking the survey. You are a UCR employee on campus property. I don't know if someone from dining is on the call, that they might be able to comment on that. My only other comment would be that the barn has a specific type of contract, and the CDPH guidelines also are very specific to dining facilities. They go above and beyond what's expected of institutes of higher education. And so they have a number of protocols that they have to follow that are completely separate than what we're talking about today. So if it was, maybe I shouldn't say anything unless if there's someone from dining or housing that might want to weigh in.
I don't think we have anyone on our panel, but maybe Linda, we could get the answer to that question separately.
Sure, we can definitely look into it and follow up with them. So if we have an employee student who claims inability to wear a mask due to breathing issues, do staff have the right to refuse service? Does the student employee need to be directed to another on-campus service to seek accommodation? Mary, this might fall under you a little bit as well.
Yes, they need to seek an accommodation. So there should be some type of parameters in place. And I don't have all the information right now, but they would definitely work with, if it's a staff member, they would need to work with the Disability Management Office. And I believe with students, they would work with the Disability Access Office for students.
Great. So if I return to campus and am working in my private office with the door closed, can I remove my mask?
So I will say that officially the CDPH guidelines and what we're following is that if you are working on the campus property, you need to wear a mask at all times.
Right.
That's a tough one. Yeah.
We learn something on every call, right? If picking up a device from ITS, 10-minute appointment is a clearance required. Visitors include staff and students, and I see shaking heads of yes. So yes, you still need to complete the daily wellness check survey and receive a clearance certificate. All right. And then I saw a question come in the chat. I'm not 100% certain I understand, so hopefully somebody on the panel might understand. The question is the same surveys used for visitors to the natural reserves? And so I'm thinking what is meant is, yeah, go ahead, Sheila, you know what it is.
Yeah, so Estella, this would be, yes, the natural reserve should be using the same survey. Now, if you are at A&R, which I don't think is part of the natural reserve, it's separate, if it's the CNAS managed natural reserves, then yes, we should be using our own. if it is the ANR or, yes, CNAS. Okay, so absolutely, yes, CNAS reserves should be completing the same survey.
All right, thank you so much for clarifying. And I believe that is all we have for questions. There's a question in the chat, sorry, that just came in, is how will ITS know if they've been cleared? If you're not a supervisor of the staff student picking up the device from ITS, how will ITS know that they've been cleared? ITS won't know that the employee has been cleared, but the supervisor will, and they're the ones giving the approval for the employee or student to go onto campus. Sheila, any additional things?
I would say that you can always show your clearance on your phone.
Great. Yes, thank you. That's a great thing. Yes, you get it emailed to you, so you can show it on your phone. The Botanical Gardens is also open again. How do non-UCR visitors log in there?
Botanical Gardens are open. How do non-UCR visitors log in?
Yeah, I'm thinking, Sheila, we may have to get clarification. Like some of these things, the garden is open to the public, I believe. So maybe, Linda, let's just reach out to Botanical Gardens and ask them what is required for visitors.
So that's actually a great example of a unit that would require approval to reopen, and that approval would need to come in the form of that worksite specific plan, and then also be routed to either the Public Health Committee, I'm assuming, for verification that it's complete and they've considered all the risks, and that they have plans for mitigation of those risks prior to opening.
Right, great. So I pulled some of the questions that we said we'd follow up on. And then Sheila, I believe this is for you regarding the CNAS. The question is also, the visitors also, the non-affiliate survey, and if you see it, it's in the chat. There's a follow-up to the original question.
Oh, in the chat, okay. Sometimes I just have to read it to understand it. 1 second. So where are we? Is this Stella? Yes. Okay. So CNAS, yes. The visitors also, the non-affiliate survey. Yes, again, so just like the Botanic Gardens, if the natural reserves are open and functioning to any extent, they need to have a worksite specific plan completed that ensures that they've assessed all the risks and that they have mechanisms to ensure that those that are coming into their facility, into the natural reserve, have gone through some level of clearance. And so I think it would be appropriate to have steps outlined in that plan of how exactly they're going to do that. And then that plan should be reviewed by the committee.
Thank you, Sheila, and thank you, Linda. We're going to have to wrap this up because we're running a bit over, but we really thank everyone for attending this webinar. And please feel free, if you have any further questions, you can email that COVID-19 email address, and we'd be happy to get back to you with the answers. So thank you to all the panelists, and have a good afternoon.